CBM is an international Christian disability and development organization, and our mission is to improve the quality of life of people with disabilities and those at risk of disability in the poorest communities of the world. And one of our core values is building an inclusive society, and we aim to see inclusion in every aspect of development, that people with disabilities are included in mainstream development. Within their regular life, people with disabilities tend to be isolated, to experience social isolation. They tend to be affected by poverty. They tend to be affected by discrimination. In time of an emergency, this increases their vulnerability in the sense that you might find that there is limitation for people with disabilities to access emergency response services because of difficulties with mobility, difficulties with hearing and seeing, difficulties with being able to move around as other community members have been able to do so. Children with disabilities that are not in school will not be able to access or benefit from school nutrition programs. And so the issue of vulnerability makes inclusion the way to go when it comes to addressing an emergency response.
The situation during the emergency was very bad. Children with disabilities suffered most, and also the women. When the relief food came from CBM, we organized the people, and there was community targeting for the people who were most vulnerable. The community didn't even know that people with disabilities were there. They only knew very few. And when the targeting was done, the people with disabilities were left out.
Kurali nampara indaletagirwo indaleterwo irio gikundi giki gya spark bandeteire irio ibampere nyambeu ibambakire nyomba indaleterwo into bya ngugi ndeteri kinyata gata kasora kagutumagira nyomba ndeteri into bya nyomba bibinge na kinya gitangi kya ruji mbikiri na kuna tusia tu twana baba kikundio kiu kyandetere.
The absenteeism of the pupils was very high, especially the pupils with disabilities, because they had nobody to bring them to school. We were lucky to have a good cooperation with SPAC. They gave us food and we were able to bring back the children to school. There was no longer malnutrition as was earlier discovered by the Ministry of Health in this place. The health of the pupils was really improved.
During the food crisis, the specific activities that we partner with CBM to provide include identification of persons with disability, assessment of persons with disability, the medical assessments, and provision of mobility aid. Because we realize mobility is a big challenge to enable most of the persons with disability to reach emergency response centers.